Her name is Merja Rapeli. Merja is a ministerial advisor at the Ministry of Social Affairs and Health in Finland, working in the preparedness unit. Prior to that, she worked at the social services in various municipalities and for the Red Cross. Her background is in sociology and social work, and currently she is a licentiate student at the University of Tampere with research focus on disaster studies and social work. So Merja, please, the floor is yours.
Okay, thank you. Gudrun and Gudni, dear colleagues, I'm very pleased to be able to have been invited here to present some of the aspects of Finnish social work and our preparedness in Finland. The contents of my presentation, I will tell you a little bit about preparedness issues and preparedness planning in general in Finland, basic things of social services, how that has been organized in Finland, and then more specifically about social services preparedness planning. In Finland, as in many other countries, at least in the Nordic countries, municipalities, they are the core actors in disaster management. In Finland, we have 317 municipalities, and they play important role in the local level preparedness. They are important in everyday life of people's well-being. They take care of public basic social and healthcare services, education and culture, infrastructure and so on. In Finland we have regional authorities that are 6, and they have an important role also in preparedness. They guide and monitor and organize exercises for the municipal level, local level preparedness. We also have some municipal based regional authorities, or they are like joint municipalities, like rescue services are organized in 22 rescue areas in Finland, and special healthcare in 20 districts, and these are municipal level organizations in joint municipalities. The legal framework of preparedness is it's obligatory for all authorities to do preparedness planning. We have a security strategy of the society from 2010, and that is like a government resolution that guides our preparedness in Finland. That is multi-hazard and multi-agency approach that we have in the security strategy, and even in the local level, that is the basis when they do their risk analysis and preparedness work. Ministry of Social Affairs and Health and our sector, we are, according to the strategy, we are responsible for the population's income security and capability to function, and that includes the basic services, social and healthcare services, taking care of vaccinations and all that kind of things. Our ministry, we have given guidelines for social sector preparedness planning in 2008, and we are in the process of renewing and like integrating the social services and health services preparedness planning guidelines, but we are waiting for the structural changes that we can really go on with that work. And then about social services, we have some new legislation on social services that is very fresh. social services, they are organized in either by a single municipality or in cooperation with other municipalities, and the tasks that we have for social services are social work, family care, home care, rehabilitation services, social rehabilitation, housing, institutional care, support for transportation, that is in the new legislation mentioned now, mental and substance abuse care, social assistance, and a new thing that we have in our legislation is supporting crisis situations. Also, emergency social services is better now in our new, mentioned in our new legislation on social services. We have also the responsibility of the social services is in the municipal level and in the responsibility of authorities, but we can purchase and do purchase services from the private sector, and in the social services it's about 30% that is purchased from the private sector. And the most common private social services are service housing for the elderly people, home care for elderly and disabled persons, and institutional and foster care for children and youth. When we talk about preparedness planning, it is the municipalities that do the preparedness plans, and all the sectors do sub-plans for the municipal level, local level plans, and social services do make their sub-plans for the overall local preparedness plans. And then when we talk about risks, actually we are working on our national risk analysis at the moment in Finland. That is because of the European Union directives that all the EU countries have to complete their national risk analysis by the end of this year. So we are also working on that. Ministry of the Interior is taking the responsibility for that, but we have the multi-agency approach, and we, all the other ministries, also our sector is involved in the national risk analysis. That is the basis for the local level. Of course, in the local level they assess the risks, but they use the national level risk analysis as a basis. Finland, we belong to a low risk area as far as natural disasters are concerned. However, climate change is something that can cause and is causing more extreme weather conditions also in Finland. Storms and floods, heavy rains, for example, that cause power cuts that are especially hazardous in remote areas, especially in the winter, for example, for home care patients and clients. We have big mass accidents, violence, school shootings that we had 2007 and 2008. We actually have Henna Haravuori here in the audience, who has studied how the students exposed have coped with their experiences after the school shootings. So there's a specialist here if you want to ask more about how that was handled in Finland and what were the effects. Epidemics, pandemics, of course, water-related events, and of course we have these new kinds of threats, even in the local level, and of course in the close to the people in the services, cyber threats. We are dependent on computerized and also internet-based functions, as we all know. We quite a lot talk about hybrid threats in this global situation now, and our big neighbor. We are working on that. And then of course we have these nuclear, biological, chemical threats as we have had before. And then just some examples, short examples of the hazards that we have had. Last year in April we had an aircraft accident at Jämijärvi. It was accident during a skydiving event. Actually, for this event also we have in the audience from Vantaa Social and Emergency Center, who acts as national support body for the local level psychosocial support. There are representatives in the audience if you want to hear more about how it was managed, the psychosocial support in this accident. Everything didn't go as well as it should have been, and actually after the accidents there were 8 skydivers that died and 3 were injured, so it wasn't very big number of people. But when we were thinking about who actually are the victims, I understood that this Vantaa specialists, they were counting that there were 200 close persons to these persons that were died or injured in the accident, and as it was an event in the areas, there were many eyewitnesses and families, children watching the event. So it was quite a big event, and our Safety Investigation Authority had made an investigation of the situation, and we, as the Ministry of Social Affairs and Health, got some things to do that we actually should have done even after the school shootings. We got some recommendation then, and we just haven't been able to structure our system so that it would be well enough for psychosocial support in such kind of mass accidents where the clients and those affected are from like a little bit much bigger area than just one local community. But I hope this Safety Investigation Authority's recommendations, I hope now we have the window open again and we can try to restructure our functions. Then some words about the storms and how they have affected. We made a little survey, actually sent a survey for 1,300 private sector institutions in Finland, and asked how did they, what were the measures they were taken after the winter storms in the Christmas time 2013-14. I think all the Nordic countries had, Norway had big storms then, and we had it a little bit, not so big one, but it really affected some parts of Finland. There were power cuts for quite a long time, and we asked the private social care institutions and services how were they affected, and the answers, there were 797 answers, and that we got back, and 5% had big disruptions, and 20% some consequences for the services. They had power cuts and cuts in the water supplies and waste management. They had to change their means of providing meals, for example. They had to use bottled water. Some had generators that were in use. Some had to evacuate their clients. They had to ask for assistance from relatives and next to kin and volunteers to be able to run the services. But only 11% reported that they had contingency planning or that was required in the service purchases agreement from the municipality's side. So that is a big deficit that we have. The municipalities, they have the responsibility for the services, and when they purchase those from the private sector, they don't always remember to think about hazardous situations, exceptional situations, and put that in the agreements. But then a little bit more precisely for the social services and social work and the preparedness plans. as I was introduced, I'm working in the Ministry of Social Affairs and Health, but I'm also studying at the Tampere University, having postgraduate studies, and my part of my licentiate studies I have gathered all the preparedness plans, these sub-plans from the municipalities, and actually I have data of all data. I have made a document analysis of all the mainland Finland social services preparedness plans. There are 255 plans that I have, preparedness plans, and they represent the 302 mainland Finland municipalities. And in this study, and now when I speak, I talk about social work also, not only social services, but social work I understand is quite broad, and I want to talk about social work because that is more like practical and closer to the actions which are taken in the disaster situations. Services is more like bureaucratic word, so social work is like the actors who implement the social services, one could say, and not only the qualified social workers that are doing it. I consider the crisis workers and those background in the social sciences that are included here in the concept of social work. But some basic things about the data. 84% of the municipalities in Finland, they have completed their social services preparedness planning. Well, one can ask whether this is good or not, but at least, we have the guidelines and we have the plans, at least in almost all of the municipalities. There are some big, I think there are 2 big cities over 20,000 inhabitants that haven't completed it. And at this moment when I was gathering these, and then some of the joint municipalities that are quite new, that I know that they are in the process. I hope that they are in the process of doing their preparedness planning. So I think we have done it quite well in Finland, in the paper, in the written preparedness plan level. Well, the length mode is 18 pages. They range from 4 to 230, so there's quite variance. Majority is about 20 pages. And 77% of those are written during the past 3 years, so they are not very old, but you can find very old ones also in the plans. And then the role of social work. I have been viewing these roles from the point of view of social capital that here is used to represent valuable social networks between individuals, groups and organizations, and it is like social capital that bridges individual action and social structures together, and I think it is quite useful in social work to use this kind of approach of social capital and the forms of bonding, bridging and linking of social capital that I have grouped these. This is the way I have grouped the functions and interventions of social work. So, social work ordinary roles that you can see there, it shows that 91% of the preparedness plans, they consist and the social work ordinary roles in the plans, that is the mean. And that consists of for example, child welfare services, elderly care, home care services, and the ordinary roles that social work, social services do have. In mean, 91% are mentioned in the plans. It depends a little bit. The child welfare services, for example, are mentioned in 98% of the plans. But then when we look a little bit more specifically of the plans, and the vulnerability assessment, that should be also mentioned in the plans, that the role of social work is not only to take care of the ordinary roles, but they should assess who are the most vulnerable in that situation after the disaster. There can be expanding tasks in the situation. It's only in half of the plans that you can find that they have mentioned that vulnerability assessment should be done. Then we have these social work extending roles that should be planned, and I have counted psychosocial support as an extending role, even that it is like a normal, ordinary role also, but that is something that is really expanding in the disaster situations. That is quite well, but that is now in these social work extending roles included there. But there is also sheltering and clothing and taking care of food and nutrition for those affected. Those are quite well, also very well mentioned in the plans. But then also when we go to a little bit more specifically to look what they have planned, for example, do they mention extending guidance needs or maybe opening a hotline? That is not mentioned in the level that it should be in the plans. So in general level they have done it, but then more specifically I think they should have done that also. Social work management, like team leading, that is well mentioned there. But then when we think how do you support the management of social work, that is taking care of situational awareness of the whole situation, that is very poorly mentioned in the plans. Only 37% of the plans have any mentioning of situational awareness and how to organize that. And then financial assistance, that is one of the ordinary roles, and that is well mentioned in the plans, that is something that is expanding usually in the disaster situations. Then the interventions of that are like more like bridging with various bridging persons to individuals to organizations or with bridging various close organizations together. For example, a cooperation with basic healthcare, that should be and is integrated in Finland social and healthcare. 94% of the preparedness plans they mention basic healthcare as a cooperative partner, and they can be even in the same organization, but they can be in some areas a little bit separate organizations. This is a little bit confusing how it is organized at the moment in Finland. Hopefully we'll get some better structures in the future. But basic healthcare is quite well mentioned. Special healthcare, the hospital district in own districts in only half of the preparedness plans. Cooperation with volunteers and church that are really supporting the basic social work tasks in disaster situations. They are quite well mentioned in the plans, but then when we look at whether they have agreements with the volunteer organizations, for example, that is very low level mentioned, and I know that we have guided that they should have agreements, written agreements with the volunteer sector, but it's only 7% that has done that. And cooperation with the private sector. In these preparedness plans, there are in 19% there is a mention that they have included private sector contingency planning in their agreements with the private sector. So this is a little bit the other side when looking from this side of the written preparedness plan. From the survey side, we got the number of 11%. Then social work preparedness training, that is mentioned in 82% of the plans, and finances for securing the disaster preparedness actions and also response actions, that is mentioned in only half of the plans. And then cooperation with wider disaster management as like more like linking to wider disaster management, joint exercises, public information, cooperation with rescue and police, and support to rescue and civil defense organizations. That is also, they mention the cooperation, but then when they should mention the tasks, what are their tasks, they are not in the same level when you go a little bit more specifically to see it in the plans. Social work should be included in the joint municipal management, disaster management. It's only 75% that mention that. And then alarming systems, how they are defined, not in the level that they should be. And then also in the information is mentioned in almost all of the plans, that it is important to take care of information. And then, but then when you look at the means and the measures, like web information or social media, then you can't find those in the plans. And then this is some kind of picture where I try to to combine all these results. I know that you don't see very much of it, and I don't have very much time to explain it, but I have tried to gather the bonding functions and then bridging and linking functions into this picture, and the final conclusions that I come to is that the obligation of preparedness planning that is fulfilled, but it is done in very general level, as you can see, and of course this is only in the written preparedness plan, so that is they have the obligation to do that, but in actual situations it is a chaos situation and so on, but we know that if you have the plan, it is a little bit better maybe thought beforehand if you have that, so you could maybe manage the situation better if you have some kind of plan. So social work and social services, they are prepared for taking care of the ordinary roles and existing clients during the disasters, but they should also be prepared for taking care of the new clients and groups and do the vulnerability assessments. There are deficiencies in supporting the management and decision making with situational picture. Alarming systems is something that is not well organized in Finland. I know that there are good examples, for example the Spanta, who is represented here today, but in general we have deficiencies in the real operational systems in the social services. Hopefully our new legislation will bring some better for this. Also information for the public, that is something that should be planned a little bit better. And then cooperation between authorities, the private sector and volunteers, and more exercises and training are needed. So I think my time is out now, so thank you.